Afulocin uses, how to use, and important precautions. Afulocin is an injectable antibiotic that contains the active ingredient Pefloxacin as Pefloxacin mesylate dihydrate at a concentration of 400 mg in each 5 ml vial of solution. In addition to Pefloxacin, Afulocin also includes excipients such as sodium ascorbate, methane sulphonic acid, and sterile. What is Afulocin? What is Afulocin? Afulocin is an injectable antibiotic that contains the active ingredient Pefloxacin as Pefloxacin mesylate dihydrate at a concentration of 400 mg in each 5 ml vial of solution. In addition to Pefloxacin, Afulocin also includes excipients such as sodium ascorbate, methane sulphonic acid, and sterile water for injection. Uses of Afulocin. Uses of Afulocin. The active ingredient Pefloxacin in Afulocin is a quinolone antibiotic, also known as a DNA gyrase inhibitor. The mechanism of action of Pefloxacin is to inhibit the enzyme DNA gyrase, an enzyme essential for the DNA replication process of bacteria. Inhibition of DNA gyrase disrupts chromosome replication, leading to bacterial inability to reproduce and ultimately their destruction. Uses of Afulocin. Pefloxacin has a broad antibacterial spectrum, covering most strains of gram and gram bacteria. Bacteria sensitive to Afulocin include Neisseria gonorrhoeae, the bacteria that cause gonorrhea. H. influenza, bacteria that cause otitis media, pneumonia, and meningitis. Uses of Afulocin. Moraxella catarrhalis, bacteria that cause otitis media and sinusitis. Escherichia coli, bacteria that cause urinary tract infections and gastrointestinal infections. Salmonella spp, bacteria that cause typhoid fever. Shigella spp, bacteria that cause dysentery. Uses of Afulocin. Staphylococcus aureus, bacteria that cause skin infections and pneumonia. Streptococcus pneumoniae, bacteria that cause pneumonia and otitis media. Afulocin is used to treat bacterial infections caused by bacteria sensitive to the drug, including uses of Afulocin. Respiratory infections, pneumonia, otitis media, sinusitis. Urinary tract infections, cystitis, pyelonephritis. Gastrointestinal infections, enteritis, diarrhea. Skin and soft tissue infections. Bacteremia. Gonorrhea. How to use Afulocin. Afulocin is administered intravenously and should be used under the supervision of a doctor. The dosage and method of using Afulocin depend on the patient's condition, age, weight, and liver and kidney function. Important precautions when using Afulocin. Afulocin should only be used as prescribed by a doctor. Do not self-medicate without consulting a doctor. You should inform your doctor about your health condition, medical history, any medications you are currently using, allergies, pregnancy, and breastfeeding before using Afulocin. Important precautions when using Afulocin. Always use the medication according to the dosage and duration prescribed by your doctor. Do not stop using the medication, even if you feel better. Report to your doctor if you experience any side effects while using Afulocin. Side effects of Afulocin. Afulocin can cause some side effects such as nausea, vomiting, diarrhea, abdominal pain, dizziness, headache, rash, itching, hepatitis, elevated liver enzymes, and kidney failure. Drug interactions. Afulocin can interact with other medications, reducing the effectiveness of the drug or increasing the risk of side effects. Therefore, you should inform your doctor about any medications you are currently using before using Afulocin. Storage. Afulocin should be stored at room temperature, in a dry place, away from direct sunlight. Keep the drug out of reach of children. Note: this article is for informational purposes only and is not a substitute for medical advice. Consult a doctor or pharmacist for the most appropriate advice for your health condition.